I invite Dr. Anil Bankar. He is the Vice President, Business Intelligence, Global Destination Health from United States of America. And earlier he was working as an assistant professor in many universities in India and in one of the important universities in UAE, that is in Dubai. And he has also worked with some companies with the medical tourism or health facilities with the government of UAE as well. And right now he's taking care of 3 to 4 centers from USA, London, Istanbul, and many other areas. So with this, Anil, I welcome you, and please you can enlighten the students with your research, what you learned in the department, and how you have taken it forward to enhance yourself. And again, more you will be having more students. So how are you going to use this research in future?
I would like to thank you, Department of Tourism Administration, giving me an opportunity to share my experience with you, how this medical tourism research impacted on the policy formation. We'll go to step by step. How I started this research, I will just briefly explain. And then I thought theme is about the innovation. Let's try something different, try something new. So this is the first time I'm trying this presentation in a different way. There is no PowerPoint slide, but earlier we used to write on a blackboard, and there's now everything is replaced with the technology. So how we can align with our old education system with the technology, and I'm trying. Please excuse me, this is my first time. If it won't work properly, so I'm sorry for that. But I'm trying. I will try my level best and hope you will like it. So are you excited? Okay, let's start. So I was talking about the medical tourism research and the its impact on the policy formation. So in 2009, I officially registered for medical tourism research. So my topic was an analytical study of organization and management of medical tourism in the state of Maharashtra, because Maharashtra state has a potential for medical tourism, a tremendous potential for medical tourism, and we have proven that. So we started, we means our department, I'm considering about our department, because since morning you are listening many lectures about the innovation and different new forms and innovative forms we have developed, and we are working on that, whether it is Sufi tourism, whether it is Ambedkar tourism, whether it is a tourist police. So these are the very innovative and unique concept we are working on that. So medical tourism also one of that, and it was a pioneer research study in 2009 till 2014. Dear friend, if you see after 2014 and before 2014, so I won't say because of our research many policy has been revised, but we are the influencers and we are the pioneer. We ask questions to stakeholders, come together, we convince the government to make the policy on it. So I will share all these details with you. So now next 15-20 minutes I will share my knowledge, I'll share all the process, how this medical tourism, my research work influences in local, regional, national, and beyond the borders. So you must be aware about the medical tourism industry, right? Now last 15 years this term is booming. Okay, now it is very famous term. Most of the people medical tourism, medical travel, medical value travel, health tourism, wellness tourism, there are the different forms, but I am not going to be define and redefine medical tourism, our topic, and we will discuss more on about the research base and how this research base help us me personally. So it will start with like this. I will share with you. Okay. The impact, or rather you can say the influence, personal development, personal development. Maybe many times I will use the shortcut, so we will avoid the times. Personal development. Okay, then in local, where you're from, like Aurangabad. So what we did in Aurangabad and how this research helped to the city. Then regional, national, and beyond borders. Excuse me for my handwriting, dear friends. Okay, but I will explain. Okay, so each step, how this medical tourism research influenced or impacted. Okay, personal development, where I was earlier and where I am now. Before started the research, so I was an ordinary person. Now also I'm an ordinary person, but because of the medical tourism research and the study and the experience, I got many opportunity to work with the biggest institutes in the world, and I was part of the government to making the national occupational standards. So I will share all the details. So we need to understand what is the relation. So we have some point and some case studies, so I will try to complete all within given time. So first we will see what is the relation between research and policy. Okay, so you must be aware about that. What is the relation between policy? So knowledge shapes policy. So research, when we're talking the research, the aspects of knowledge, policy, politics. Most of the governance or politics, that terms. I would like to share an example. So with this example, we will see the cycle of policy formation and where our research work fits over there. If I want to give an example in the current situation, like pandemic is going on, most of the medical traveler, they are not traveling. So this is the problem now. There is a perception about people are scared to travel. So they build like if we travel, we got we may infected by COVID-19. So that perception has been built from last 4 or 5 months. So that's why we have organized this webinar to restart the tourism. So we are thinking how we can restart the tourism in a normal way. So where the policy will plays very important role. So if we want to see the policy formation. So take an example, like if you want to make the SOPs for the medical traveler. So first we need to set the agenda. The medical traveler who wants to travel for the treatment, like some kind of surgeries, they want to do it and they are just waiting from long time, and again they cannot extend more. So for them, government, most of the governments they already place, they have some policies. But now it's time to revise the policies. So I'm just trying to explain policies formation. Okay, so and then we'll understand with the case studies how it work actually. So I can prove that this is the procedure and how I'm working on that policy formation practice. Okay, so first agenda, then after the setting the agenda, we have to set the agenda. Maybe that governing body or entities, they will set the agenda. After the agenda, they will policy formation. So this is very important point. In the policy formation, we have to involve the stakeholders over here. So maybe the expert from the industries, like a doctors, we are talking about the developing the SOPs for the international patients. So here medical facilitators, doctors, healthcare consultants, travel agents, tour operators, airlines. So we have to involve them, we have to take their inputs, and then we have to make the policy, that the policy formation. After the policy formation, we have to convince the people, the stakeholders, and then policy adoption. So everyone is thinking, yes, really it is important. So maybe all the stakeholders agree about that. Yes, we have to make the SOPs for the safe travel. Then policy adoption. I don't know, you can see it or this, but I am reading also, so you will understand. I am sorry for my handwriting. Okay, first is agenda setting, then policy formation, policy adoption, then fourth point is implementation, policy implementations. Okay, I just write in shortcut. Okay, so in proper place it will be implemented. So every medical tourism facilitators or hospitals or airlines, they have to follow the SOPs. Then after that we have to do the assessment. Okay, policy assessment. So this is also very important. If, like for example, we format the policy, we adopt the policy, we implement the policy, but what are the problems occurring? Like for example, if they're traveling from one country to another country, they are spreading more infection because of them. Both the countries are suffering. So we need to assess whatever policy we have formed or we have implemented. So we do the assessment. If there is any lacuna, if there is again the problem, again this cycle will go continue unless and until it will go in a smooth way. So this is the way the policy formation. Now we will talk about some medical tourism policies. MT policy. I will write in very short form. So medical tourism policy, most of the countries, most of the Asian countries, they have a policy in place. They have developed their infrastructure. So they took a political decision. They have to position their country or their destination as a medical tourism destination, a wellness tourism destination, health tourism destination, and they are working on that ethical, legal aspects, patient safety. Okay. So when I'm talking about the infrastructure, okay, what do you mean by infrastructure? Infrastructure is not about the how many hospitals building. We are building the how many hospitals over there, number of hotels, road. Okay, that amenities are important. Infrastructure is for 3 P's. We call it the 3 P's. Okay. First is people, process, and policy. These are very, very important. Okay. In medical tourism, most of the policy implication on the health of local people. So when I was doing the research that time, I especially focus on the sustainable medical tourism, because if you are promoting any destination is promoting medical tourism, so one side international patient or wealthy patients are getting 5-star treatment, and other sides your local patient dying on a street. So it is not a development. So we have to think about the people. It should not be implicated their health situation. The process should be defined. Each and every there is a cycle, medical tourism cycle, and that cycle and that process, each and every step should be defined, and the policy should be in place. So if you see the current status of medical tourism industry, so an average is around, why I'm saying an average, because if you I took out some information about the most authentic organization like UNWTO, WHO, and many times many governments, they are facing the problems. Forming a medical tourism policy is challenging, because there is no authentic research available, there is no authentic data available. Whatever data is available, that data is very poor data. Okay, so now most of the youngsters and the stakeholders, most of the young researchers are working on that. And now recently UNWTO published a wonderful research on the wellness tourism, how this wellness tourism and the health tourism industry will take over on medical tourism. So we are talking about the around $70 billion industry, but very soon it will touch $100 billion industry. and the wellness tourism, it will be around $400 billion industry. So who are the leading player in this industry? When I started my research, the very few countries were promoting medical tourism. Now if you see, the more than 100 countries are promoting medical tourism, but who are the leaders in medical tourism? So I was mentioning about the most of the Asian countries already have their policy. So if you see, like Thailand, Malaysia, Singapore, Turkey, India, these are the countries called the medical. I'm not saying that these are the top 5 countries or top 10 countries, but these are the leading medical tourism destinations. Okay, every destination has their separate USP, and they have their policies, they have their SOPs. Okay, and now UAE, United Arab Emirates, where I'm studying, and I'm so happy and announced that I was a part of some of the policy forming. So I will discuss that also with you. So before that, so these are the countries already have a policy, already they have the infrastructure, they have this people, process, and the policy. Now the UAE government, they have vision to bring 500,000 international patients, so they are developing good SOPs, technology. They have a very good platform, that is a single window platform. And I would like to share a case study about the NQA side. Okay, so you can see NQA, NOS, QF, WIT. Okay, so NQA is a national qualification authority, as a part of federal government of UAE. So NQA in making the qualification frameworks, that is QF qualification frameworks. Like for example, if one person is working in a travel agency or tour operator, so in that workplace, what are the competency he has to achieve? What are the skill he is required when he is working in that industry, and when he is working on particular that job profile? So what are the job profile in medical tourism industries? Okay, and to work in this industry, what are the skill is required? So UAE government identified this problem area. So there is no organization management of medical tourism. That was my research topic, my PhD research topic. So they organized one meeting with all the stakeholders. So from academic, I was working with the Gulf Medical University that time, and they invited us to discuss about how we can develop the knowledge for the tourism industry. That was the tourism industry, and then I highlighted them the importance of medical tourism industry, and we have to focus on the medical tourism industry, and they appreciate about all this thing. And then we form SAC. It is called SAC, Sector Advisory Committee. So like same for example, so we take how the pharmacy, we have seen how the policy has been formulated. So here we set the agenda to develop the knowledge for medical tourism industry. And then we started working on the policy formation. Like in policy formation, we have to involve the stakeholder. So this sector advisory committee made a point. These are the areas of like patient safety, health regulations, visa rules and regulation, pre-operative care, post-operative care, then continuity of care. So many points were there, and what will the job profile of the person who's working there, whether it is a DPM, destination program manager, a care manager, case manager, medical tourism facilitator. So we already work on that, and then we involve all the medical tourism stakeholders, and now we are trying to adopt this policy. So because of the pandemic, now it is on hold, but it will take time. Generally all this policy, it will take years and years. So national occupational standards, so they are developing the standards for the medical tourism industry. So not only for the medical tourism, every sector is involved, but just because of my research, because of the medical tourism research, I am able to convince them to develop the NOS for the medical tourism industry, and now we are working on that. So that this is the way, like you can see, the personal development was there. Even when I was in Aurangabad, so though I contacted many doctors over there, and try to form one club. It's a medico travel club, and through that medico travel club, we were, wherever I was going for the conference and the workshop, that time I was promoting Aurangabad as a medical tourism destinations, because it is very cost effective destination compared to all other destination and the metro cities in India. And then the national level also, we approach many agencies. I'm a part of Advantage Healthcare also, so we are brainstorming and trying through how we can shape up the India as a leading brand in medical and the wellness tourism. And then beyond the border, like this is the one I was a part of developing the NOS, National Occupational Standard for medical tourism. Then after that, I got opportunity to work with the DSCC. DSCC stand for the Dubai Healthcare City. Dubai Healthcare City Medical, there are the different division: Dubai Healthcare City Authority, Dubai Healthcare City Regulatory. I was a part of Dubai Healthcare City Medical. So in Dubai Healthcare City, there are near about the 120 hospitals and clinics. It's kind of healthcare cluster. In that cluster, you will find all kind of hospitals, super specialty, multi specialty. So the authority decided that we will form. This is the first time kind of government initiative to start the health tourism center. So it is a single window for all the patients who are coming to healthcare city, so they will get the benefit of this. So I was developing the strategy, doing the feasibility study, market research, conducting survey, interacting with the stakeholders. So this is the first kind of, why this is the first kind of initiative of government and DSCC, because most of the government who are promoting medical tourism, so they are just promoting medical tourism, they are not into actual operation. So the first time DSCC is trying to being in operation, so actual operation of medical tourism and health tourism, how we can help the patient and develop the good SOPs, develop those standards for the healthcare service providers too. So they have to follow this protocol, they have to follow the standards, and we can provide the good safety measures for the international patients. So this is the way, these are the two case studies with the influences of my research, and it is impacted. I am able to be part of this. So I am just trying to see whether we missed out any point. Even I was a part of MHWTC. MHWTC, this is MHWTC, Maharashtra Health and Wellness Tourism Congress. Panduza Solution had organized one conference with the government of Maharashtra to position Maharashtra as a leading brand in health tourism. So there are a lot of buyers were there, and they had some problems to identify the right doctor, to identify the facilitator. So Panduza was the instrumental to bring all stakeholders together from Maharashtra, and that's what we are trying to be instrumental, how we can form the policy for the government of Maharashtra and they implement the policy. So this is very important. So whatever research you are doing, whatever research topic you are selecting, it should be part, maybe it should be help to the formation of policy and an implementation of policy. So if you see, when I was talking about the research and the policy, if you see the researcher, if I have 20 over there, what I will do, I will just try to remove this, and then. So did you like this? Okay, to finish just next 10 minutes I will finish. Give me the comments where I can improve. I will improve. I know my speed, but about this one innovative method. So, what is your opinion? Please text me, message me. So I will improve whether you liked it not. So researcher, it is stand for researcher and the policy makers. Okay, so researcher generally like we have to identify the research problem, right? Then we will form the hypothesis, okay, questionnaire, then survey, okay, then we'll identify the methods, then we'll communicate, and then result analysis, and then after that a report. Okay, if you see the policy makers, when they want to form the policy, so they have to identify the problem. Okay, same problem, then they have to work on the formulation of the evidence. They have to collect the evidence, what are the evidence of this problem. Okay, they will see the alternatives, what are the alternatives. Like most of the time, most of the policy, whether that office is or the entity is working, it's a time bound. Maybe for the research to get the result, it take 3 years, 2 years, 5 years. But if they want to policy in the time, within a particular time frame, maybe in a 1 year or 2 years, or within a 6 months or 4 months, so whatever research data is available, so they will try to analyze, and they want to make the modified it, and if it is required, they will do the further study. Okay, then the similar again, the communication with the stakeholders, and the develop the report, implementation. Okay, so your research topic and your research, like through my research topic and the this research areas, so it somewhere, I'm not saying the 100% or maybe it's a 0.5% or 4%, I would able to contribute for the policy formation. Not only just for the policy formation, but if you see on a academic side, so you can see, and I started with the Dr. Ambedkar Marathwada University. Then I got an opportunity to ICRI, India Institute of Clinical Research India, where I was teaching the medical tourism subject, and then later revised the syllabus. And then after that, got the opportunity in Gulf Medical University, where I formed the medical tourism course, developed the content, developed the complete course. Now many students are working in the industry. So you can see the one research topic, which was very innovative topic, it got the benefited to. There are some direct benefit and there are some indirect benefits. So these are the indirect benefit. Then I have been invited by the Chiba University in Japan. In that Chiba University, especially for the nurses, we developed one training program, and now I'm associated with the German-based TUV Rhineland, TÜV Rhineland. So I'm developed another one advanced course on medical tourism. So very soon we are launching this program. So where you can be specialized after the completion of this program. So it is approved by the TÜV Rhineland. TÜV Rhineland is worldwide. They are working, and this certificate will be acceptable worldwide. So this is the way, this is the journey. There is a gap between researchers and the policy makers. So we have to bridge this gap through communicate with them. They maybe we have to accept each other's whatever findings or the problems areas, the discuss on the various problems areas, and we can work together. So dear friends, researchers, I will encourage many young researchers, think about the innovative topic, think about the out of the box, and how your research work is gonna benefit to you personally, you locally, regionally, nationally, and beyond the borders. So this is the way I have been working in this industry from last 10 years, so I have to do many things. I'm still working on the how we can make this industry in an organized form. Most of the stakeholders are working together. So if you have any idea about the formation of medical tourism policy or related to health tourism, wellness tourism, I would like to contribute and share, because having an idea and executing that idea, that is very different thing. So maybe I have many ideas but I'm stuck somewhere, so together we can work, like our department is also working on that. So so really this is I'm very thankful to the Department of Tourism Administration because of them. So these are the research culture, they just they planted seeds in our mind, and now I'm sure it will grow. Just to, I think most of the point I have covered. If I missed anything, you can just text me or chat me, so I will try to cover up that point again. So this is the culture, and just for your information, my wife is also working on destination branding. They are doing research on the destination branding. So tourism research, because of the tourism, so we are here, we are working on that, and everyone, we will try to restart tourism. I know that tourism right now, tourism industry, it's not in a that position, the graph is downside, but I'm very optimistic this industry will bounce back. So thank you so much for listening, and please let me know if you like this innovative presentation, and if I want to improve any areas, let me know. We will improve and we will work together. Yes, dear friend, definitely we will work together. I just want to share with you my current position. I am working with the Global Medical Services. It's a US based company. You can see we have 5 verticals in our company, and we have offices across the globe. We are super excited to work with Indian stakeholders. Very soon we are starting our office in India also. So I'm basically dealing with the global destination health, but I'm a part of other divisions too. So we are looking to work together, and new partners, new investors, and a very innovative way. We are also trying to do something in healthcare. So our motto, our objective is healthcare should be accessible to each and every one. So we are working towards our goal, and we need your support. Thank you so much. See you. Be in touch with. This is my contact details. If you have any queries, if you want to discuss any project, so you can contact me anytime.